welcome to all of you to Interfaith America, this World AIDS Day webinar, Crisis, Community, and Campus Life's Response to HIV and AIDS. Again, I'd like to welcome all of you to today, a special welcome to our panelists, who I will invite to introduce themselves in a few minutes. I want to say a special thank you to Don Abram, Program Manager here at Interfaith America, and all the other staff who have assisted Don to make this webinar possible this morning. I am Fred Davie, Reverend Frederick Davie, Senior Advisor for Racial Equity at Interfaith America. Interfaith America was founded by Dr. Ibu Patel 20 years ago. He is currently Interfaith America's president as well. Interfaith America inspires, equips, and connects leaders and institutions to unlock the potential of America's religious diversity. We know that diversity manifests in many ways in a variety of institutions and settings. Greek societies and American life are one of the spaces where this is true. We also know the impact of Greek societies, faith traditions represented within them, have on issues of sexual health and human sexuality, all of which is related to healthy practices when it comes to HIV and AIDS. And that's why this morning we've assembled this impressive panel to discuss these matters on World AIDS Day. So let's take a moment of silence to remember those who we have lost to HIV and AIDS, those who have health issues today related to this phenomenon, and those who live healthy lives in the presence of managing HIV and AIDS, and those who carry the virus within their body and who are thriving and growing and being successful and examples for those who come after them. So let's take a moment of silence for all of those in our community that we would hold up at this time on World AIDS Day. So just a quick moment of silence. Thank you. And I would like to start by asking if Dr. Vivan Carter would provide us with a 1-minute introduction, although I know 1 minute won't do justice to any of our panelists in terms of introducing themselves, but we'll ask them to give us the Cliff Notes version of their bio today. So we'll start with Dr. Vivan Carter. Dr. Carter.
No, good morning. I bring everyone greetings from the campus of Tuskegee University. I am the chair of the Department of Psychology and Sociology. I am also the former assistant director for the Tuskegee National Center for Bioethics. I have been leading the charge around the state of Alabama, where I have served on the Alabama HIV Task Force. I was appointed by the governor, and I also continue to work with the Montgomery AIDS Outreach Group. And so again, I thank you for this opportunity and in recognizing the importance of this day.
Thank you. Mr. Kolbey Gardner.
Good morning, everyone. My name is Kolbey Gardner. I am an entrepreneur, an author, an activist. I currently serve as the president of United Strategies Group, a firm that I started back in 2019. Since our initial launch, we have worked with over 60 campaigns, nonprofits, and political action organizations all over the country, raising dollars to ensure that their voices can be heard. We've raised about $8 million to date, working on races all the way from school board all the way up to President of the United States. It's a pleasure to be here with this distinguished panel today, talking about this extremely important issue. I hope to have a robust conversation and hopefully we can continue to work to end this epidemic.
Thank you so much, Mr. Gardner. And now for Dr. Bambi Gaddist.
Good morning. My name is Bambi Gaddist. I have to give a shout out to Dr. Carter. I am a former Tuskegee Tiger. I currently, well, let me talk backdrop. For 27 years, I was CEO of a nonprofit organization, the South Carolina HIV Council Right Wellness Center. We were probably the largest provider of non-medical clinical services for testing, mobile unit outreach, and working for communities. In recent days, I serve as a public health consultant. I have recently created a more structured way of providing service through an LLC, Structural Health Dynamics. And I have been blessed, I would say, for the last, I'm scared to say, 30 plus years of my public health assignment, working in HIV, AIDS, working with HBCUs and faith leaders and a host of communities. So I'm really excited about this conversation, particularly because it's being hosted by Interfaith America, which I strongly believe is a critical link that needs to be edified if we're going to deal with this epidemic in the long run.
Thank you so much, Dr. Gaddist. And now Dr. Illya Davis.
Hello, and thank you so much for allowing me to participate. Again, Illya Davis. I'm from Atlanta, Georgia. I am a graduate of Morehouse College, and now I am a professor of philosophy here, and I'm also the director of freshman and seniors academic success. And I am very excited. I have also participated on multiple occasions with the Bioethics Center at Tuskegee under Dr. Warren at the time. I'm assuming he's still there. Mm-hmm. And it was wonderful to do that as well. So I welcome this opportunity. With respect to my areas, I do Africana philosophy, philosophy of language, as well as levels of epistemology. So I'm very excited because this is an ongoing area of interest, and particularly because I am at an all-male serving institution and the only Black one in the country. And so it gives me a unique perspective, I believe, because the conversations are often colored by those types of experiences. So thank you again.
Thank you, Dr. Davis. And we are excited to get started with all of you. So I will start with an opening question, and then I will go in reverse order then and ask for responses. So my first question is, fraternities and sororities are influential social impact organizations, as we said, on and off campus. Many have contributed to leveraging their networks, influence, and cultural power to raise awareness about ongoing HIV and AIDS epidemic. Can you talk to us then about how, what your experience with the Greek societies has been in engaging around this issue? And Dr. Davis, we'll start with you.
Okay, well, obviously I must begin. Any statements that I make are not official statements of the Omega Psi Phi Fraternity Incorporated. You know, I can just hear someone say, hey, but be that as it may, I am a member and a proud member. And as a representative, I think I can say without equivocating that we fundamentally are invested in the development, cultivation, and refinement of humanity. And I think toward that end, health is fundamental, mental health, physical health. And so I think one of the greatest advantages of my organization and the others is that you have a ready-made workforce that can immediately engage many of the social ills that we do address and need to be addressed politically, socially, economically, and so forth. And so there lies a great advantage that you don't have to go out and cull, you don't have to go and create a group to make certain types of progressive movements. They're already ready-made. I think that's a major advantage of these organizations. And because unique to Black Greek letter organizations, they were fundamentally grounded in social, political, economic movements. And so there again, you don't have to convince them of the worth and the value of something like HIV AIDS work. It's just a matter of getting it done. And I think that these organizations have and will continue to have a tendency toward trying to provide insight and then some programmatic things that can be done. And I think obviously there are many things that could be done that aren't being done. I would never want anyone to think that I am trying to deliver some utopian notion of what we do. But I think there's a lot of work that could be done. And I would even argue that we probably stand at the precipice of creating the dialogue in this area and others with respect to women's rights, protection of their bodies, and so forth. I would not want to disaggregate these things. And I think that's part of the reason why people overlook the importance of HIV and AIDS. They wish to disaggregate and try to insert themselves at the juncture that they find their existential quality of life, right? So if someone is not a member of a respective group, they desegregate, they disaggregate and allow those things to exist outside of them. So in short, I think that the organizations have always had a tendency to focus in on these primary things and turn the virtue into human existence into an active engagement with them.
Thank you so much. Dr. Gaddist.
So what I'm hoping I'm doing is adding on to the content that's being shared. When I think, first of all, let me note, in 1976, I pledged Alpha Kappa Alpha, Gamma Kappa chapter at Tuskegee. And so it is in that space that we were, it was instilled in us that we should be, as Dr. Davis has indicated, people of service, that we should be a fearless voice, that we should stand up for those that cannot stand up for themselves, and we should demonstrate that daily in some way, shape, or form. And so when I think about the sororities and fraternities, particularly on HBCUs, I think of intergenerational armies of brilliant minds, because in fact, this is a infection that impacts the young and the old. And I'll throw myself in the old at this point at 67. Okay, so it is what it is. And we have to bridge intergenerational differences in how we see how this infection is impacting us. Those of us who are older, we have to call upon young adults and young professionals and brilliant minds to help guide us through some of the things that we missed. They have the energy that some of us may not have to do what needs to be done. They sit in the pews of churches and have an opportunity to address stigma and shame and things that unfortunately have been fostered in the institution that we're trying to engage here. And then finally, as a community advocate who's taken many blows for the work in HIV, along with many of my colleagues who struggle with people trying to readdress attitudes and beliefs. The fact is that we need to change policies. We need to change guidelines, things that foster stigma, prejudices, and hold people living with HIV in bondage so that they cannot live a quality of life. And so when I think of fraternities and sororities, I remain anxious to continue the work that I'm working in and partnering with others to get it done, because they, as it's been said, are a large answer to our plight right now.
Thank you. Ms. Gardner.
Absolutely. As I begin this conversation, I must frame it with a little information about how I joined my fraternity. I entered Clark Atlanta University in the fall of 2008, a very historic time for our country with the election of President Barack Obama. I was just 16 years old, so I couldn't yet vote myself, but I marched and I rallied and was truly inspired by that work. It was then around that time I was also doing my research into the different fraternities and sororities that existed on the campus of Clark Atlanta University again. And I found Phi Beta Sigma in two ways. One, I was extremely attracted to their values of service, but also their motto, culture for service and service to humanity, which anecdotally is a part of the motto for Clark Atlanta University as well, culture for service. And while I believe that science has advanced so much to improve lives over the course of this disease, I believe it's also our society that has shifted its views and attitudes to be more inclusive of these conversations throughout that time as well. I was doing the research about the different fraternities, and I came across a program in Phi Beta Sigma called Living Well Brother to Brother, that really focused in very specifically around the conversation about HIV and AIDS. And the fact that I saw a Black Greek letter organization having that conversation really attracted me to my organization. And I think that we have to continue to have tough conversations and have them in places where, as Dr. Davis spoke to, you have these chapters full of young people on all over the country, and we need to continue to have that conversation more broadly, just outside of our chapters, but also with the greater community as well. Like a great Sigma man always said, I think that it's important that we share our values with the world, and that's how you make the community better.
Thank you so much. Dr. Carter.
Okay, well, let me first state, I am a proud member of Delta Sigma Theta Sorority Incorporated. I have entered that because of the fact that that is what I was born into. I was born to be a Delta, and very proud of that legacy. Let me just say that in speaking about Delta, I will say that we have made this part of our program thrust. It's part of our 5-point thrust for the sorority. So we are no strangers to speaking about the issues, bringing them to the forefront. On Tuskegee's campus, our young ladies, and I have been here since 1998, but they were involved and really pushing the issues prior to my coming to the campus. And they continue to hold screenings and testings and education sessions throughout the semesters on the campus. And every year the alumni chapter as well as the undergraduate chapter have partnered with me on the Healthy Lifestyles Marathon, where we bring a plethora of information regarding health. And also remember that as we go into annually the Jubilee, which celebrates the crossing of the Edmund Pettus Bridge, we are always there front and center in supporting the health and HIV discussions. So that's one thing that I can say in terms of, being there. Now, in terms of the progress, there's much to be done, still much to be done. And as I've stated, many times, I concur with Dr. Gaddist about the fact that there needs to be an emphasis on the policies, dealing with the policies, but not only that, again, with my bioethics background, looking at this from that lens, one of the things that we want to talk about, not just the policies, but also in terms of the distribution of funding and support for research. HBCUs are on the back end of that support. And yet we are the ones, that are located in these communities. It is our community that is most at risk. And yet we are not being funded nor supported to do the work that needs to be done or that could be done. I'm surrounded by just gifted, extremely gifted young people who could do so much more, but the issue is, do we have support? Do we have funding to do the work that needs to be done? And the other part of it is in terms of the policy support. Do we have that support from our communities in terms of addressing these policy issues?
Thank you so much. And before I go to the next question, I'm going to remind our audience that you can submit questions, I think either through the Q&A or chat, and we will get to the audience questions a little bit later in our program.
Are we
I'm-
permitted to respond to?
Yeah,
something
sure,
that's said?
absolutely. Please, go ahead.
I want to edify Dr. Carter's statement, and I think it's broader. It's in order to see a day when her vision that we all agree on comes to manifestation. That, part of when I think of sororities and fraternities, I think that they should be engaged in their different cognate areas. For example, I'm as a ambassador for HVTN, the HIV Clinical Trials Network. My experiences on campuses that although these infections and health disparities impact us, we are not involved in clinical trial research.
Yes.
We're not doing the research, nor are we being engaged in being part of the solutions. We clearly saw that in COVID. I think COVID brought to light one of the first times that African Americans and other communities of color took part in the clinical trials, which eventually led to the creation of a vaccine that helped us overcome the impact of that disease. And so integrating clinical trial discussions in our science programs. From a policy perspective, if you ask the average person, and I'll close on this, who is the person that represents you in the House of Representatives? Who represents you in the Senate in your district or in your state? Right at Tuskegee, for example, who is the legislator or county council or city council person that represents where you sit? And when we can't answer those questions, those are the makings of apathy. When we know who's governing over us, then we are more likely to take part in addressing policies that cripple us and that keep us from reaching our best selves. And so I think that one of the things we can do as we talk about HIV as a focus is, what are the laws that are in place that are crippling our people? And how do we integrate and educate HBCU students about those laws, whether it's in psychology, whether it's in social work, whether it's in public health, or whatever the discipline? We should engage them. Those of us that are doing the work, advocating, have to engage them in these kinds of conversations, because they're the next generation of leaders that are going to take my place and all of us at some point in time.
Great, thanks so much, and very insightful and important look at this issue and the factors and the dynamics at play there. Let me shift gears just a little bit. I'm going to ask each of you an individual question, and it may have a little bit more to do with culture and living than with some of the more technical aspects of this, and particularly focused on the South. So, Dr. Davis, I'm going to start with you, a sort of a general question about Southern culture. So the South represents about 38% of the US population, yet 51% of HIV/AIDS infections. What do you think is going on?
Oh, it's as if you read my mind. So I'm going to try to account for a big picture and make it small. I believe that many of these issues are fundamentally entrenched in an underserved educational structure. Part of what we deal with, all of us who teach, trying to be reasonable with people who have reached conclusions without the use of reason. And so what happens is, over time, that builds up, and now you have adults who resist and are recalcitrant to new information. And it has to be a formidable part of our educational structures to allow people to understand this is how you introduce new ideas, and that you should be open. What we call in philosophy the notion of fallibilism. The idea is that you should always be open to modifying and editing your beliefs in light of countervailing evidence that overrides that information. And so I find this to be at the core. So let's look at the South. I am a wonderfully excited Southerner from Atlanta, Georgia, but Atlanta's turning out to be not so Southern. And, we have these carpetbaggers who come here now. So I'm joking. But the thing is, in a very traditional sense, it is grounded in the idea of a lack of trust in systems for good reason. That's not just arbitrary or a priori, that we do have reasons not to be trustful of institutions, particularly the government, for various reasons. And so all of these things and many more that I am not articulating now come to bear on people's belief systems. And so when you have these moments of impasse, that is information that can be useful versus your history that is going to somehow inform you, and then your own take on these things. So in the South, we have a tendency to say, some folk ain't ever been for you, right? Certain phrases that everybody knows, all skin folk ain't kinfolk. I mean, it's just all these phrases that become a formidable part of our thinking, as trifling or as trivial as you may think they are. They're formidable in creating ideas of reality and value. So HIV/AIDS in the South is going to be viewed differently because we're also in the Bible Belt. And so for some misconstruals of religious texts that I don't even intend to or compelled to engage, I mean, you have people who live in Deuteronomic notions of, the suffering upon people who deserve it. Then you have the wisdom writings that are supposed to say, well, you're protected if you do what God wants you to, but it will never befall you if you. Yeah, but that's real. And so I remember students early on saying that, even Katrina was the outcome of decadent society. HIV/AIDS, it was due because people weren't living right. That's real in the South. It is really profound. And it just doesn't inhabit the religious institutions. It inhabits the barbershops, the beauty shops, the schoolrooms. So circuitously to my point again, and I'll end, our educational system, it's not fundamentally grounded in critique and analysis with the possibility of redacting your ideas of reality in light of countervailing evidence. So it's hard to convince somebody who's 13 as well as somebody who's 83 that the way you view the world is wrong. It's just outright wrong. So the idea of the shaking a brother's hand who may be gay or a sister who's lesbian, that you could contract a disease and then give them evidence to the contrary, and they resist it. There becomes what Frantz Fanon refers to, a certain cognitive dissonance, that you can't even embrace the possibility. That's just outright wrong. Like I said, you're fighting irrationality with rationality.
Thank you, sir. Dr. Carter, so I'm going to drill down a little bit more with Southern sort of overview look. Let's talk about the African-American community. And Dr. Gaddist and Mr. Gardner, I have specific questions for you as well as about particular populations, but let's just do generally the African-American community in the South. 53% of all new HIV/AIDS infections in the South are among African-Americans. What do you think's going on there?
You're on mute, Dr. Carter.
Thank you. I'm sorry. We did a study that began to look at the trends in terms of HIV in rural, especially rural Southern communities. One of the things that we found that a lot of the cases that we are seeing were actually diagnosed in another location, and then, as with most families, I know with my experience, is that when those individuals become sick, they want to come home. And for most people, home is where? The South. And when they come home, a lot of the treatment programs are not available, especially in rural communities. They're not available there. Now, and we do have to deal with, as Dr. Davis has stated, we do have to deal with this notion of resistance and this certain amount of cognitive dissonance in terms of dealing with this issue of being diagnosed and even gaining treatment. That has been one of my big pet peeves, is making sure that people have access to the latest treatments for HIV in these communities, and that they are aware. This is again a big issue, but we do have to deal with the idea of the stigma. Those are very, very pronounced things, and we have this ideal in the South that whatever happens in my house stays in my house. I don't want everybody knowing my business. You know, I have support groups that meet outside of the county because they don't want anybody in that county to even suspect that they're positive. So we have these groups, and this is real. It's not imagined. It's real. You don't, and then a lot of people don't want to go to the health department because, you know, Miss Mary knows Miss Annie, everybody knows everybody. And when they see that diagnosis, then they, you know, they're gonna talk, regardless of all the oaths and whatever that we take, we do. And so we have to address this. And we have to be upfront and say there is no, you know, that there is no sin. If we're talking about sin, yes, my pastor always says, there's no big sin, no little sin, and all of us have it. So, you know, you can't look at me and talk about my sin without talking about your own. So we have to deal with that. We have to be upfront, take the sting out of the stigma. Okay, this is still a human being. This is still a disease like any other disease. I always call it the gift of COVID, which gave us a lot of unity in terms around addressing this issue and empowerment. I will say, you know, whether people like it or not, it did empower HBCUs. You know, I said, you know, Dr. Gaddist talked about, you know, getting those persons to participate in those clinical trials. You know, I was one of those people sitting on those review committees with Dr. Montgomery Rice and others and saying, you don't have enough minority participants to release this. When we see this amount, but then they had to come back, well, where can we find them? And we told them, you go to the HBCUs and we have them because we are them. And that's what we had to do. I mean, but again, that was empowering because, again, it brought recognition to who we are, what we can do, and the fact that we are there. They can't deny it. And we have to, again, bring the same energy, the same idea. And as Dr. Gaddist knows, she's come back to Tuskegee for the Lifting the Veil, the think tank. Yeah, you know, and we had some real discussion. Okay, we got to have it. We got to have these real talks, and we got to touch each other as human beings. You know, I wish to God that someone with the energy that I'm seeing today was there when my loved one was going through and succumb. But we're getting there. But we have a big hill to climb in terms of addressing the stigma and addressing the structural issues within the institutions themselves that provide healthcare.
Great, thank you so much. Dr. Gaddist, of all new HIV/AIDS infections in the South among women, 67% are among African-American women. Why is that?
Whoa. Let me know. I think the causation of it it's multifaceted. So let me be clear. I'm not trying to single out any particular. I think it's a culmination, and some of it's what related to the question you just asked. You know, when we look at the incidence or who is most likely to report a new HIV infection, when we are pondering what is the prevalence in a particular group, we all know that we are struggling against the increased incidence of HIV among young gay men of color between the ages of 18 and 29. And it is relevant, but there are reasons why I believe that when we love Black men, and so let me just say in general, we need more Black men engaged in this fight, not just young gay men of color. what we call cisgender, heterosexually saying they are Black men. We need them in this fight. They are uncles, they are grandfathers, they are, they represent for our community and for our families, a critical part of the unit, but they are not and have not been actively engaged in this dialogue, in addressing policies and guidelines that negatively impact our people. And so when I think of Black women, certainly Black women that have intimate love, have sexual relations with Black men, we have to acknowledge that that's where we're contracting it primarily. Yes, there are other modes of transmission, but they do not seem to support how we're getting acquiring HIV. Number two, when it comes to innovations like pre-exposure prophylaxis or PrEP, which we know is a 1 pill a day regimen, we call it the other blue pill. You know, men have their blue pill. We want our blue pill. Just like we want insurance access to bioidentical hormone therapy, which helps us address our menopause. My point being, Black women are not always brought into innovations where we are aware that these things even exist. I've said in churches recently, and I've asked a group of congregants in front of me, how many of you have ever heard of PrEP? How many of you know that there is a biomedical innovation that if you take a pill a day, you could almost eliminate your likelihood of acquisition? Or if you wanted a baby and your man is positive, you could reduce the chances that you or your offspring will acquire. And they look at me and they say, I don't know what you're talking about. And so in closure, I think the other thing that we have to address and don't have spaces or not creating spaces, back to sororities and what we could be doing to engage conversation. You know, the ratio for men and Black women is dwindling. We're talking a ratio of 1 to 12, 1 to 15, 1 man for every 15 women. So somebody's sharing. The likelihood of some sharing is very high. So what does it look like to navigate our sexual lives? And by the way, Black, women want to be sexually active. We want to have intimacy. We want a sex life now and when we old, whatever old means to you. And in order to get to that space and have a viable partner, we need to know how to navigate our options and to know how to protect ourselves. So some of this is environmental, why Black women are overrepresented. Some of it is internal to our community and messages we give to Black women about their sexuality and what we're not supposed to do and what we're permitted to do. And then some of it is historical. And we haven't talked much about that as it relates to slavery and how we were subjugated, how Black men were treated, how our women were treated, and how even today we can, which is a whole nother conversation, especially in the South, talk about what's been the long-term impact of our history and when we were considered expendable. Especially in the South. And I live in a state where in South Carolina, where we have great beaches, but those same beaches were the beaches that they brought slaves into Charleston. And we have names of people like J. Marion Sims who experimented on Black women to create the innovations of gynecology. But nobody knows that. But those are the things we must remember and what we need to educate our young people about and look at how do we address those things in the here and the now.
Thank you so much. Thank you. Ms. Gardner, so men who have sex with men, obviously men of color who have sex with men, as Dr. Gaddist has alluded to, are clearly overrepresented, particularly in the South. HIV/AIDS infections. Fraternities and to some degree sororities, but let's focus on fraternities now, particularly Black fraternities, Black fraternities, if they're fraternities, they are male, are viewed by some as organizations for the successful, for the elites, if you will. How do fraternities and organizations of hypermasculinity in some respects? So how do fraternities, with this kind of perception among some, elite, professional, hyperly masculine, how did they help to address issues of men of color who have sex with men, and all of the issues related to that when it comes to HIV and AIDS infections? What can fraternities really do to address these issues?
And thank you so much for that question. As I think about again the Black fraternities and the conversation about elitism, I think I go back to again my time in undergrad when having conversations about membership and even the requirements to join a fraternity. You have to, again, in most places, have a certain GPA, but then even beyond that, you have to be first admitted to college. And as I look at the rates for Black men going, not only graduating high school and then making it to college, that's already creating a barrier of access that creates that illusion of elitism, I believe, that separates in a lot of ways the conversation between some of those Black men in their community. I think that this same conversation we've been having since the conversation around the talented 10th, around folks going back into their communities after they achieve a certain level of success, and then going back to then lift their fellow community members up. And we're not seeing that. We're seeing people graduate college, start their families, and remain sequestered in areas where everyone looks and thinks like them, the members of their church, the members of their chapters of their particular Greek letter organization. And that does create a certain level of separation, I believe, in between the folks who have achieved this level of success and the community members that where they started their lives with, in a lot of ways. And I think that it becomes our more imperative to not only go back, but to go back with the intention of staying and not just during times of community service, but to live in these places, to go to the stores, to go to the churches, to socialize with them, to have those deep conversations just beyond a visit. And I think that it becomes a little harder because a variety of reasons, too many for me to list here, around the barriers of access to go back to those communities to have those tough conversations. I believe that there are some solutions that could be reached, but I'm not sure we're there just yet. And those are pretty much my high-level thoughts there.
Right. Thank you so much. So one of the questions from the audience, and we'll go to that, and then I would ask you to be prepared if you wish to give any kind of concluding remarks that you like. But one of the questions from the audience, and I'll let anybody take this who wants, is why is there so much disinformation in the African American communities, and what can we do to counter it? And I saw a big smile come across Dr. Davis's face, so I'll start with him, and then I'll just open it up for any of the other panelists who want to address it.
Well, I'm laughing. That's that Nobel Prize answer, right? Why is there so much misinformation? This takes us back to what I would like to continue to focus on. Our educational structures are just bad. Part of what I like to teach is to learn how to disagree without being disagreeable. And there's a tendency for us to always try to conflate conversations to agreement. I mean, these stand in the way of the level of development that we need. And so misinformation is only misinformation because people don't know how to discern the various levels of critical analysis of truth, what may be true, what may be false. And I'm not talking about theorizing truth. I'm literally saying it's counter to reality as we know it, with the possibility of us changing in the future. That's just that basic. Just be willing to be open to the possibility. I tell students when they come in, everything you learned in high school very well may be wrong. Find out while you're in college, right? This is the point where you find out if what you learned can stand the time and test of and evaluations of. So that's a fundamental problem. The other issue I wanted to drop in very quickly is that I believe that we must address the fear of death. When the question earlier about how it is that it proliferates in our communities, we don't deal well with death. And that is, I remember in the 80s when I was at Morehouse and, the development of what they thought at the time was this overwhelming gay disease that a group of my friends, and to my knowledge, we were all heterosexual, we went together to get tested. You could have watered a lake with the sweat coming off our brows. I mean, because we were afraid. And obviously the science is different now. See, we had to be open but then 85, 86, you're going to die. That was the lore. And so we went into the doctor and the doctor asked several questions and he tried to calm us down. Sorry, brother, there was no calming us down. It was death. And so I remember not being able to sleep. I stayed up until I got my results. I mean,
and those were the days when you didn't get your results back for 7 to 10 days.
Who you telling? Do you realize I wouldn't even sleep in my bed. I slept on my sofa. I was just overwhelmed. Of course, the science is better now. Of course, the numbers have gone down now, but there's no recession of fear. You understand that? There's no recession of fear. So we've done nothing to mitigate fear across the board, with HIV and AIDS being one tier among other tiers. People were afraid of COVID only when someone started to die that you didn't expect to die, right? Same thing with HIV AIDS. No one cared unless it hit home. And that fails the test of care. And care must be extended to those, even if I have no relationship, even if you're outside of my demographic, you're not a member of my set of beings. And so the fear of death alone keeps us from getting tested. I don't want to know. I'd rather die in my sleep, as we might say, than to know I'm going to die in my sleep. Isn't that amazing? I'd rather be blissfully ignorant, let it happen. So when you talked about the question with Dr. Gaddist about women, I think that's a lot of it. A lot of people who do have it, even if they think there may be a possibility, I'd rather die without knowing death is so imminent, which we might look at as immature, but I think it is fundamental to where we have to go. We're going to have to do some education generally in order to get the specific things redressed appropriately.
But you won't do that until we do some self-examination.
Oh, yes, definitely.
We have some institutions that govern our lives as Black folks, whether it's faith, whether it's Black doctors who render certain types, because misinformation is different than disinformation.
Yes.
Where you have somebody says something and you think you understood it, and that's why it's so important that we say to people, what is it you think I'm saying? So they can bring it back to us and we can correct or modify. But when people just flat out lie, create disinformation to, as you've noted, to move people to agreement, and then to reinforce it societally or in our community to create penalties for not adhering to or acquiring the mentality that's being pushed. That's where we have to first do self-examination.
Yes.
What policies do we have on our HBCUs that are fostering homophobia, stigma, disregard for gender identity?
And you know what, I'll very quickly right there, I want to point, I have to tell, because I have freshmen and seniors under my care, I have to remind families when they come, and that's Tuskegee, wherever, you gave him to us like this. I mean, don't blame, that's one thing I will defend colleges. We try to do our best to push and create controversy. I want to worry you. I want to get on your nerves. But people need to realize you did this to him or her for 18 years. We can't resolve this overnight. And I only say that hyperbolically to say, yes, the country is anti-gay. It's anti-women. It's anti-trans. He came here. Do you understand that? To whatever respective college we're in. And now people look at, well, my God. Yeah, we're a microcosm. Tuskegee is no different than the country. Morehouse, Spelman, all of these. We have to and to your point, that's a fundamental element. Can we get on students' nerve enough? Well, we force them, even if you believe it, you won't say it. See, that's the thing. I'm also, I'm young 57, but old enough to know that
Whatever.
if you don't agree with me, sometimes I can accept your disagreement in your silence. No one asks you to hate me aloud, right? And that's one thing that, again, teaching students to realize that the world is not here for your pleasure. And this is
also incorporating opportunities with our faculty and staff.
Oh, yes.
To help them confront their personal attitudes, beliefs, and behaviors that are perpetuating in the classroom that make students feel threatened because of who they are. Looking at where do we house students, even down to where do we house students who come to, as you noted, come in our doors, not looking like, being like the majority of what we call the regular population. Are we ready to receive them? That's the self-analysis that we're struggling through as Black institutions, wherever we are, sororities, fraternities, faiths, academics. We are, but I'll say this in a positive note and be quiet. I'm currently collaborating with 6 HBCUs here in South Carolina. This is not the first time we've done it, but this is the second time that we have been working with leadership to administer a student health behavior survey. So that the data that we collect on their freshman populations can be used for two purposes. One, to look at, based on de-identified student self-reported behaviors, what programs do we need to put in place? If it's alcohol and drugs, then let's explore, based on what's self-reported, how we could be of support. If we have students who are already sexually active, when they come in, what programs do we need? What healthcare access points can we create on our campuses to make sure that, especially in rural communities where healthcare is already lacking, where hospitals are closing, that our students get access? So I look, but the other part is research, what Dr. Carter was addressing. How do we take this information and enhance programs, but create access to healthcare, but also engage our students? We're bringing student monitors, we're paying them to be part of the data collection so that they can have something to build on their resume and they can see what it's like to be involved in a process that actually benefits them as students. And so we have to look desperately for opportunities to engage them so they can see a vision of what it's like to do research and to do something that has a yield where they see the manifestation of the work they're doing.
That's great. Thank you so much. I want to get a little more personal now with each of you. Interfaith America believes in the value and strength of faith traditions or philosophical traditions or spiritual traditions in being sources of inspiration, power, energy, direction, clarity of thought for how we order, manage our lives and make meaning in this world. So I'm curious to hear from each of you, if I can intrude a little bit into your spiritual faith, philosophical lives. What helps you as you tap that source, that well? Is there a particular philosophical framework, Dr. Davis? Scriptural word, particular faith orientation for any of you? Talk to us a little bit about that, if you will.
My mother, I mean, when I look at my mother, I mean, I always tell my students specifically, I've seen God. I've seen her, and she's been present from the time immemorial as far as I'm concerned. And so these exemplary human beings who've come into my life, who forced me to question what I thought was true, what I thought was correct, that's where I get my energy, my motivation, because they showed me, don't allow the perfect to ruin the good. So they never expect more out of me than I should expect of myself. And so those things keep me moving. But the fundamental virtues of respect, dignity, care, love, my job is to try to do this. So when I lay my head down every night, I should be able to say to myself, I did it. Right? I did it. And I try to warn students, don't assume we'll see each other again. So if you're not going to do it today, don't ever. I mean, because the point is every day is the last one. And so I live this way, not in a sort of morbid, maudlin sense, but more a matter of the reality of life and death. And that I do not want to be arrogant enough to assume that I can call it, right? The idea, see you tomorrow. No, I'm sorry for what I said to you. I beg your pardon. I love you. I mean, these are the things that we fail. And I would not wish to sort of extrapolate and say, most of society won't do this. And again, I'm sorry to say it, but it's not going to happen. And we keep talking this way about common faith and common beliefs and the common good. Those are good ideas, but I don't want that to restrict us from doing what we can do in our respective locations. That is, you got to love from where you are and lead with love. And that's what I try to do. But I learned this from my mother. And many of us are here. Maybe Kolbey doesn't know this, but we used to get spankings and they say, I do this because I love you. Kolbey's that next generation. They call DCF and, but for the rest of us, and I learned this later on. She was trying to prevent as best she could. My mother raised 6 of us, 4 boys and 2 girls alone. And her point was, this is all I know to do. I mean, I'm trying to love you. So when I'm motivated to care, it can't be because I'm like you. It's fundamentally because you and I have nothing in common, Brother Davie, that I have to love you, right? I don't want to be a narcissist and love you because you're me. And I think a lot of us look for that, right? Oh, we're the same. No, we're not. And the love has to be representative of that fundamental difference that makes us beautiful people.
Thank you so much. We're about out of time. Dr. Carter, give me 30 seconds on sort of what keeps you sustained from a spiritual or faith perspective.
I just have to be honest with you. I'm the daughter of a military officer and a healthcare worker. And what they always tell me is faith without works is dead. Faith without works is dead. You got to do the work. And God has given you a gift and a talent, use it.
Great. Thank you so much. Dr. Gaddist, 30 seconds.
I would quote the scripture from the book of Ecclesiastes that was not published in King James, the book of Sirach, Sirach, chapter 38, where it talks about sickness and medicine. And what guides me in this space is to continue our mission. We are called into this work with my community to help them understand that there is healing in traditional medicine, but there is also science in medicine, and that we have to find a equilibrium between the two, because we're all going to expire at some point. But in the meantime, we can rely on herbs and things that are traditional healing practices, but we better pay attention to science. And God put physicians on this earth to heal, and he works through them. And through them, we can be healed and live longer. And so that is my quest, to continue to push that message, that it's not one thing or another. It's a joint balance of both things, and we need to pay attention and educate ourselves about it.
Thank you so much. Kolbey, 30 seconds, and then we'll close out.
Awesome. Again, as a Black queer Christian man, I'm encouraged daily by my community. a group of resilient individuals who come from different socioeconomic backgrounds, different religious backgrounds, but each of us have found a strength within us to continue to do the work, continue to love, though it's hard. And that encourages me every day to get up and love my neighbor in the best way possible, like Christ compelled us to.
Well, thank you so much. This has been an incredible, incredible conversation. We are in your debt for having shared so richly and liberally from your scholarship, from your professionalism, as well as from your personal and faith lives. And we're very much appreciative of not only this hour and a half, but all you do on a daily basis to make this world better for so many. Let me tell the audience that we want to thank you for joining us as well. You can find upcoming virtual opportunities if you want at interfaithamerica.org/event. There are also more articles you can read about faith and health in our Interfaith America magazine at interfaithamerica.org. And today in an hour at 12 noon Central Time, 1 p.m. Eastern Time, there'll be a conversation in the spirit of destigmatizing HIV and AIDS. It will be on Instagram Live. You can find it on Interfaith America's Instagram site. So join us for all of these events. Check out our Interfaith America magazine and join the Instagram Live conversation in an hour. Thank you all again. Have a great rest of the day. We remember all of those who are impacted by HIV and AIDS, and we work for and pray for a day when this disease will no longer be in our midst, and we depend on people like you to help make it happen. So God bless you all. Have a great day.
Take care. Bye, Dr. Carter. Bye, Dr. Davis. Bye, Kolbey.
Bye-bye, everyone.
Bye all.